I'm Dr. Glazer. I'm one of the cosmetic dermatologists at New England Dermatology and Laser Center. And I'm here today with Ina. And Ina's come in to have filler injection. Today we're going to be using Radius. And the area that she is most concerned about are called the marionette lines. And these are lines that go from the corner of the lip down to the chin. And these lines generally come on as we get older. They're due to loss of bone structure. Sometimes they're due to loss of elasticity of the skin. And this is the way certain people age. And so we're going to try to help Ina. We've talked about what to expect, that she's had some Novocaine on, a topical anesthetic on for the last hour to numb it up. And it can be a little uncomfortable, but not terribly so, after which she can expect a little redness and swelling, a little bruising that may last a few days. So we're ready to start.
Okay.
So this product is called Radius, and Radius is one of the more hardy fillers that we have. And it works by immediate correction, but also stimulates collagen formation, so that she'll get an immediate correction and then a more sustained correction over the next 6 months or so. This product can last anywhere from 6 months to a year, and then it starts to lose its effect, and if patients are satisfied, they usually come back again for a second treatment. Each time we do it, it does tend to last a little bit longer. So we shall start. Okay, and if you just put your head back for me a little bit, and turn like this. Okay. Just open your mouth a little bit. So just open up a little bit more. Great. So tiny little, it's going to sting a little bit. How are you doing, Ina? Okay?
Yeah.
Okay. Open up a little bit more. Great. So we can just massage this out a little bit. I'm going to get a little cleanser. So what I do is I massage this a bit because it goes in and we want to make it nice and soft and smooth. It's closed now. Okay, come sit for a minute. Come sit there. Okay. So that's a nice correction. You see this nice improvement. This is nowhere near as deep as this is over here. So now we'll go ahead and correct the other side. And what we have patients do is we have them hold some cold water on the area, some cold washcloth on the area. And this reduces the chances of swelling and bruising. We frequently ask patients to avoid aspirin, vitamin E, fish oil, garlic, ibuprofen, anything that may be a blood thinner prior to treatment to try to reduce the incidence of swelling and bruising. This side's correcting a little bit easier than the other side. And that's not uncommon that one side will correct a little easier than the other. Okay. So again, we'll massage this area, make sure it goes in nice and even and smooth. And we'll clean your face off a little bit. Sometimes when we massage here, it does hurt just a little bit, but not a lot. Okay, just close it. Okay, so Ina, let me have you sit forward for a minute. Okay. Okay, so these deeper lines that she had through here now have really diminished considerably. They're softer, not as pronounced. Can you smile a little bit for us? Okay, very good.
Let me show you.
Sure. Oh wow. Yeah.
That was good.
It's a nice curve.
This one looks a little puffier.
Yeah, sometimes it's a little puffy because we did more injections on that side, so sometimes we're a little puffier. Post-treatment, we have patients apply cool water compresses. We usually ask them to add ice water and put on the cloth and apply it to the area for about 5 or 10 minutes every hour or two. And that minimizes the chances of bruising and swelling. Patients usually are a little swollen for a couple of days afterwards. The swelling goes down. We also ask them not to drink any alcohol that day, not to do any exercise, because that also can promote bruising. We also ask not to chew gum and not to drink out of a straw because that might cause some movement of the filler. And this correction is expected will last about 6 months, give or take the first time. With subsequent treatments, it's likely to last 6 months and longer, and then it can be repeated. So, it was okay for you?
Very
Not too
good. No
uncomfortable?
pain, not
Great.
at all.
Okay. Well, thank you, Ina.
Thank
Appreciate
you. Thank you.
it.